faces so that they can't
So
catch us
the still shot?
in like a weird like.
I think it's like 2 minutes in, so we should just like sit and make. Alright guys, happy Friday!
I'm doing the PS show right now. I can't come to
it is September 6th.
Hi everyone!
And today's a little different.
Let me take off my radio here.
We're getting paged. We're getting burger one now.
Happy Friday, happy September.
Yes.
But if you've been outside any time,
it doesn't feel like fall.
It feels like the dead of summer still.
Dude,
I'm so ready.
We broke 100 yesterday, I think. When I got in my car after work, it was like sizzling.
Like too hot and it's sticky.
It's nasty.
So everyone, let's all say goodbye to my blonde hair because I am so ready for fall. I'm going back to that.
You know what's funny is whenever you ask Andrea, our nurse, what her favorite color is, you know what her answer is?
Fall.
Fall. She's like, just
that's her
fall.
Color.
All things fall. So it's about to get real fall around here. Ashley said it's going to explode pumpkins and
everywhere.
Leaves and fall.
Because as our loyal patients know, we start Christmas a little early here.
Oh,
we do our holiday open house in November.
You know how Hobby Lobby like puts Christmas stuff
we
out?
Are so Hobby. That's why I had to do it actually, because if you try to go to Hobby Lobby in the month of the holiday, you won't get anything.
No, absolutely not.
Anyway, so Jess, what are we talking about today?
Today we're talking about PRP. So you're probably wondering, like, what's
There's
PRP?
Too many acronyms in plastic surgery. We do say PERP. We say PERP
like,
all the time.
PERP.
Oh, you're going to do a PERP?
Yeah.
Oh, okay, PERP.
Yeah, we're going to add on PERP? PERP? Yeah, we're going to do it.
Let me tell y'all, Platelet Rich Plasma
yes.
is stuff that everyone has in their own blood.
Yeah, it's all natural. So how do we get it? Jinx.
I know, right? Oh, hey.
Hey, Letty.
Sorry we couldn't come to your office, but we're doing the show.
Yeah, filming in progress.
Don't forget to share and comment. Let us know.
Drop us some little things.
Yeah, I want to hear from y'all.
Okay, I'm going to get it pulled up on my computer. So you were saying PERP, right?
PRP. So listen to this. So your blood has lots of stuff in it, lots of good stuff. Mm-hmm. It has white cells, red cells, but it also has platelets. And platelets are these really cool things that have growth factors, and then they have like healing elements, healing powers. I love when you can call something having powers. Like
it is kind of a superhero. It is. It actually is. It's its own superhero.
Awesome. So what else can we say about it? So we use it in 3 different ways here in the office.
But I think we should start with how do we get it? Like, how do we get it? If it's in your blood, we have to get it somewhere,
Kimberly!
Right? Our top fan!
We need to have Kim on the show.
Hey, Kim. What do you think about being a guest on the show? Top fan. We may have to borrow you on Friday. So, we'll catch up. Okay, so how do we get it?
Okay.
Right? So
it's a little spooky.
It's really not.
What Andrea does is she bites really hard on your neck.
Yeah, but you gotta get it in the right place, right? Like,
just kidding. No. Okay, so what you do is you draw blood. Your own blood. You're taking your own blood out. They spin it and do some kind of stuff to it.
Yeah, we put it in a centrifuge, which is really cool, right? That sounds like a crazy word.
Yeah.
So we draw the blood in these little tubes, and we put these tubes into the centrifuge, and it's
it spins and it does its thing.
You know at the carnival, like when you get into that thing and you like lean against the wall and the thing spins.
Oh, that's awesome.
Like that's what we do. That's what we do.
Yeah, I have seen in that.
You're the tube and the.
Okay.
Yeah, that's how it works.
Also, when you put oil and vinegar on your salads, and after you put it down for a little while, you know how it separates? That's exactly what the blood does. So the white and the red blood cells, whatever, we don't really need
They separate, basically.
Right. But the PRP is the good stuff, the gold stuff.
Yes,
can you believe that this amazing stuff is in our bodies?
I know, it's just floating around all day, every day.
So what we do is we take that PRP, the platelet rich plasmas, we can do a couple of different things with it.
Yes. So the things that we can do with it, I think that
let's say the most popular one.
Yeah, the most popular one. Great.
It's the.
But yeah, but okay.
So the one that we first started doing PRP. They're probably going to come out and say like PRP can cure cancer or something because it can do so many things, and we're always finding out new places to put it, new places that it can restore collagen and new skin, all that stuff. So the first place that most people know about it supporting is your face.
It's for our face, yeah. So we usually
do
couple
we
it.
just like get it and just like slather it on?
We just like a slingshot.
Or like a water balloon.
A water gun. Yeah, that would be funny. So we actually use it whenever we're doing skin pin, which is microneedling. We're creating these little holes and channels in the tissue. We actually use the PRP to put down into those little holes that we make, so that way that your skin can regenerate, it can heal better.
So let's put our overalls on real quick and become farmers.
Yeah, I love this.
So this is how it made sense to both of us, the whole concept of PRP. So what you do when you're a farmer, apparently, so
that wasn't our.
In order to grow the crops, you need fertilizer, right?
Exactly.
You don't need fertilizer, but have you ever tried to grow something without fertilizer?
Well, I don't have a green thumb, so no, I've never been able to grow anything without fertilizer. Except for humans.
Listen, let me just let you know. Okay.
Children, you know.
Let me just let you know that you're not going to get great results without the fertilizer, right?
Right.
So the PRP is acting as a fertilizer for the aeration that's going on, which is the skin pen.
Exactly.
So we aerate, and then we put fertilizer up in there. It's not going to make your face bigger, but it's going to restore your collagen. It's going to heal quick.
Yeah, it has wound healing properties in it, which is really cool.
Especially for skin pens.
Yes, and it helps stimulate collagen, and it increases your blood circulation. So all these things promote healthier tissue. So
the face is a great place to put it.
Exactly.
And since you're doing those controlled needle thingies,
like
aerate. I always say aerating.
Yeah.
And putting it straight in there, it's like gold in your face, and it's going to help
really
do all of those things that we've mentioned. So in addition to the face, we also, if you didn't know, we have a hair program. We need to do a show on the hair program.
Actually, we should do that.
Maybe in like
2 weeks we do that one. Okay.
Yeah. So I flipped my hair.
Okay, let me just tell you about like how we do it with the hair, because it's literally like this, almost the same concept,
right?
Or very similar. So same process is done to get the PRP, but what we actually do whenever we're using it for the hair is to increase the hair growth. And to strengthen the hair, and also promote new hair growth. Yeah, because a lot of times...
And healthy follicles.
Yeah, because sometimes our follicles typically should have multiple hairs in there coming out, right? But as hairs are thinning, we're losing that, those little multiple hairs coming through each follicle, so that's what causes things to thin.
Right.
So when we
One important thing about the PRP before I let you finish, we need a follicle. So if you're completely bald in one area, PRP would not. It's not going to be.
That's where and just other aspects of our hair program would be super beneficial, and then adding this in there in conjunction with it. So, but yes, that's a very good point. The scalp is shiny.
If there's nothing, if there's no plant and just fertilizer, it's just going to be a stinky mess. But PRP doesn't smell.
It doesn't. No, it doesn't. So. Yes. Okay. So
the third way.
Oh yeah.
And our new favorite.
We kind of previewed this last week, but I feel like I wasn't. We were trying. We were low key. We were low key, like kind of.
Yeah, we were low key about it, but so this is happening. What is it like? If you're sensitive to, whatever, it's plastic surgery. So Dr. Steinberg is going to be really focusing on, or maybe not focus, I don't know what the right word is, vaginal rejuvenation.
Yes. So, can I just tell you how beneficial PRP is for vaginal rejuvenation? Ladies, let me tell you.
What all does it do?
Are you ready to pick up what I'm laying down? Okay, you ready? Will you pick it up?
I'm ready.
Okay,
yeah,
okay.
Here you go.
Okay, awesome. Okay, so PRP for vaginal rejuvenation does a whole lot of things. So we already talked about wound healing. Hopefully there's no wounds going on.
But if you do have any pain,
yes,
that's going to help with pain.
Very much so. And I talked about it increases blood circulation. So when you have more blood flow to an area, things can function better, right? It's like giving it more oxygen so you can breathe, or giving yourself more oxygen so you can breathe. So increasing blood, whatever it needs to do to have life, right? We're just
So on the G-rated section, it helps with incontinence. It helps with pain
Yes.
that you're experiencing down there. It helps create newer, younger looking skin around the area.
Just like with the face, that's why we're doing it, to rejuvenate the skin, right? So we're doing it to rejuvenate the lady part.
Right. So in addition to doing that, I mean, let's just say it. I'm like, imagine my mom watching this and her being like, "Don't you dare say those words."
Don't.
It helps everything. It makes everything better, more enjoyable, more pleasurable, more frequent. And if you have pain, it helps with that too.
Awesome. So a lot of different things.
Yeah.
And we talked about it helping to stimulate collagen growth and helping things flourish. So it does all that for that area as well.
Helps you flourish. Not only physically, but also
you like that?
Internally.
See, I like that term. It's just so classy, and you don't even necessarily know what we're talking about, right?
I know what we're talking about.
Yeah, I know what I'm talking about too. So
anyway, we are now offering that here at the office, and we don't really have a name for it, so just whenever you call, just be like, I'm interested. And we'll give you all the information. It's a one and done type of thing.
You can even wink when you're on the phone, and we'll know.
We'll pick up. Like, hey, I'm winking, just to let you know.
Yeah.
But super exciting. I like to coin the phrase the new mommy makeover because mommies need to feel good on the inside just as well as they do on the outside.
Exactly. So to kind of sum it all up, PRP
I wrote some really smart things on my cards today. And I didn't use them.
PRP is really great. Okay.
I did remember. Okay,
get that one.
So, PRP is not only is it amazing, but it's super safe because you're using your own cells.
It's natural.
So it's not. There's very low chance of rejection, like your body can reject it, right? Or infection too. Hey,
yeah.
Okay, but it.
Okay, we have to be semi-big.
Exactly. So, and go ahead and do your overview.
Okay, so to just pretty much. Oh, look at me. Was that a gleek? Did you see that? That was weird.
What's a gleek?
Well,
like a raspberry?
You know how like there's a little
raspberry.
Like a little
spit you spit?
No, but
you spit at the patient?
I'm sorry, guys. So sorry.
Ooh.
That's why there's a screen there. I can't get through.
Wait. Answer Kim. Hey Kim.
Is it a procedure?
It is.
Yes. And there's
Is it
procedure?
It's done once. You're not put under.
Yeah. There's no like necessarily downtime as far as taking off
4 hours.
Well,
4 hours until you can engage in
activity things. But there's no real downtime as far as like you don't need to take off work. You can come here and literally from start to finish be out in and out within about an hour or less. It just all kind of depends. But we always say about an hour of time. So lunchtime, gonna come in first thing in the morning.
And you know we have some super duper smart people on our staff, especially our doctors, especially our providers, that can just talk to you about it and let you know about everything it can do and the whole process.
Yeah, and maybe if you're having some particular like symptoms or things that you're trying to target or what your goals are, then we can really direct you, whether it's down here, whether it's hair, whether it's face. So we got you back.
Yeah. So today was a quick one.
It was.
But let's tell everyone what we're doing next.
Yo!
Me and Ash and the Jess
are taking on
Dallas.
That's right, y'all. Y'all get ready.
So Jess and I are going to an AMSPA
convention
conference boot camp. We're going to be working.
It is actually a boot camp, so
we're flying on Friday around the PS showtime. So we will probably be a little bit late, or we can do it while we're waiting for the plane. Anyway,
just be on a high alert. Make sure your notifications on. Your C first for the Clinic for Plastic Surgery, because next Friday it will happen either before our normal time or a few hours after the normal time, just because we'll be in transit. We'll be in the air.
Yeah.
Like birds. So, I'm excited.
Okay, I'm excited too. We're going to do... And we can do other...
Y'all, and whenever we come back, oh man, y'all just get ready.
We're going to have so many things to talk about.
Yeah.
So we're really excited for the D-Town trip. And I get to see my little brother. We're going to go see my little brother.
Gus. Okay, so let me just wrap up, like, a few other things too, because there's kind of
what? Yeah. PRP's on sale. Next month. In October.
Or you mean preview. We'll cut that out. No, we'll leave it in. It's
Well,
live.
if you let me not do live. Anyway.
We have to do live because that's when all the bloopers are coming out. Okay. So, alright. So PRP, all natural because it's your own blood that we're drawing. It is long lasting. It is something that you can do frequently, but not too frequently. And we'll go over that with you.
Not have any more blood.
We got a lot of blood, just so you know.
No, we do. That's not even a concern.
We're just kidding.
I mean, we're not going to do it every day.
No,
but.
no. Stimulates collagen, increases blood circulation, growth factors, wound healing, all
tighter,
the things.
wetter, more frequent. They don't know what I'm talking about.
Okay. This just got
It
real.
happens.
That's
It's real.
Hilda.
Look, see? Miss McClure said, you already said it.
Oh, okay.
Thank
Megan
you.
said, always good to see you guys just... Oh, okay, you missed my picture. Dang it.
yeah.
You showed them?
Oh, I'll tell you about it later.
Dang it. Okay, send them to me because I have to see them. I have to see them.
Okay, now we're just being silly. Let's do
Okay,
this.
okay, you already said it. Okay, LO, you did it. And your friend. Keeping it real. Yes, we do keep it real on the PS show, but we have to have a little bit of a filter. Maybe. Okay, alright, anyway, so PRP is a great add-on to other procedures that we do here at our practice, whether it be injectables or skin or hair growth or vaginal rejuvenation. So it just enhances the results of other things that we're doing. So it's a great
Fertilizer.
add-on.
Think fertilizer.
Yes, that is literally
Except
the best one word.
I mean, for this and the hair, definitely it's fertilizer.
Yeah. So, all right, let's see what else. All my blood needs to be done. I love you, Kim.
I know. We need to have the two Kims on our show.
Ooh.
Y'all contact us.
We gotta do a collab. Okay, so
We'll see y'all next week
Yes.
from Dallas. And remember,
beauty's in the details.
bye everyone.
All right, guys. Have a great weekend. We'll see you next Friday. Okay, now we gotta figure out this.
You have
turning
to
out.
finish. Look right on the bottom right there. Look. Jessica.